Welcome to the Sharkpreneur podcast with Kevin Harrington and Seth Greene. Kevin Harrington is the inventor of the infomercial, one of the original sharks from the hit TV show Shark Tank, and has generated over $5 billion in TV and digital direct response sales. Seth Greene is the world's first trusted authority on cutting-edge direct response marketing, a best-selling author, and the only 3-time Marketer of the Year nominee. On the podcast, Kevin and Seth interview sharkpreneurs who share straight talk on what it takes to explode your business.
49 faces looked to him in triumph. Over the last 12 months, they had each taken turns and promoted his business for a week at a time, driving over $987,342 in revenue. What if you had a network of 50 centers of influence who promoted your business every week for a year? Grab your copy of the #1 Amazon best-selling book, The Ultimate Guide to Growing Your Business with a Podcast, at 33% off the Amazon price by going to ultimatepodcastbook.com. Again, that website for 33% off the Amazon price is ultimatepodcastbook.com. Welcome to the podcast. This is your host, Seth Greene. Today, I've got the good fortune to be with Chris Hamilton from Hotchkiss Insurance. Chris brings nearly 20 years of experience in corporate finance in the insurance industry, working with mid-market, regional, and national employers. To his role as employee benefits lead, he is focused on helping companies improve performance and profitability. Chris, thanks so much for joining us.
Seth, thanks for having me. It's a pleasure.
Our pleasure as well. Let's go back in time. How did you get started?
I started in corporate finance out of college. Spent about a little over a decade doing that. And in the process of going, in my experience in that industry, the Affordable Care Act was passed. I actually worked with health insurance brokerages at the time. At that time, they were going around the country with M&A activity, acquiring smaller firms. And the market, the institutional markets were concerned of the impact that the Affordable Care Act was going to have on earnings. And what I learned was that it was actually going to benefit a lot of the brokerage industry because of the way they're compensated. And it really sent me down this path of learning how health insurance worked, how companies bought it, how brokers and health insurance companies monetized it. And it led me down this path of asking my other clients, whether they're manufacturing companies, transportation, service industries, how do you guys manage your health insurance costs? And what I realized was a disconnect in what the end clients really wanted and what the goals and of the insurance companies and the brokers actually were. And the industry makes more money the more we pay. Most employers want to figure out how to offer the best benefits at the lowest cost. That's something that they want to manage. And if you look at their P&L, it's one of the most inflationary items that they pay for every single year. And so what I thought was, if there was a way to create a business that could help companies more effectively manage the cost of healthcare, provide better benefits to their employees, I could fill this gap, if you will, in the market and create a business that does something good for employers, that helps them do something good for their employees. And that was the genesis of the practice that we have today.
Well, congratulations on that. I'm sure the longer version of that story could probably be in a book somewhere if it wasn't already. So let's dive in. Who is an ideal client for you?
So typically it's clients that are looking to offer health insurance that are tired of the rat race of continual cost escalation every year. And this last year, 2025, was a painful year for most employers. It was not uncommon to see mid-sized employers facing 20, 30, even 40% increases or more in the cost of their health insurance. And that's on top of them having to reduce the amount of coverage that they offer their employees. Just costs are going up across the industry. So it's an employer that's sick and tired of feeling like they don't have options to manage the costs of the health insurance and the healthcare they provide to their employees.
I think a lot of us can relate to that. So what are some of the biggest, most common mistakes we're making as employers when it comes to our benefit plans?
It's not realizing you actually have more control than you're led to believe. And what I mean by that is the typical health insurance broker is going to show you just a handful of options. We're all familiar with the Blue Cross, the Anthem, United Healthcare, Cigna, Aetna, but there's so many options available to employers now, especially post implementation of the ACA. So it's been 11 years since the ACA was actually not passed, but implemented. Employers had to comply with it. There are a lot of alternative insurance arrangements that have been created for smaller, mid-sized employers all the way up through national employers. And what we're seeing is there's a lot of misaligned incentives in a traditional insurance plan. So you have an insurance company that owns pharmacy benefit managers. They also own a lot of the clinical care that's involved. And systematically, they are overcharging insurance companies, which is themselves, which justifies them increasing the rate. It's a big circular reference of profitability for these insurance companies. And so the trick to this is, how do we design an ecosystem, a health insurance plan that removes those misaligned incentives? And so there's alternative strategies out there to custom build a health insurance plan that aligns with the goals and outcomes desired by an employer.
Well, that sounds awesome. So, what are some of the strategies a small to medium-sized business can use to control those healthcare costs without compromising on the quality of the benefits?
So the biggest shift that we see happening for mid-sized employers is what's called self-funding or partially self-funding. And so when somebody hears that term, they automatically think more risk. It's dangerous. It's easy for us just to do this fully insured renewal with a health insurance company. Yes, it's 15, 20, 30% more, but I know what I'm getting that year. Well, the market has evolved for mid-sized employers. There's anything from consortiums to group health captives that allow employers to aggregate their lives with other employers to buy insurance at scale. And if it's done right, it's actually safer than being in a traditional fully insured plan because you get scale and you have the ability to pick the vendors that are part of your health insurance plan. That goes back to removing these misaligned incentives. So you can pick your pharmacy benefit manager. You're probably familiar with Mark Cuban and his Cost Plus program, his pharmaceutical plan. You can implement programs like that, but you can do that for just about everything, whether it's surgeries, medications, laboratory services. You can build this plan that strips out waste, abuse, and overbilling. And when you reduce the cost of healthcare, so I'll just use Mark Cuban as an example. Most of your listeners are probably familiar with him. A medication that might cost $1,000 a month through traditional pharmacy benefit manager, you may be able to get for 10 or 15, $20 through Mark Cuban's program. If we're able to save dollars on each individual prescription or each individual surgery, you reduce the cost of healthcare. That reduces the cost of insurance premiums that are needed to be collected to pay for the healthcare. So the whole system, we need to think about it differently. It's how do we address the rising cost of healthcare? How do we create efficient distribution channels for that? And as you lower that cost of healthcare, the insurance cost naturally comes down to common size with it.
Well, that makes a lot of sense. And I would love to not get raked over the coals and have I've often said I'd love to own a health insurance company one day so I can just raise prices 30% on people every year and there's nothing they can do about it.
Well, it's one of those things when you look at the market, just as the traditional market itself, there's not a ton of competition on the national level. And that's where it's really created the opportunity for these unique programs to come in place and compete against the big national insurance companies. It's employers that say, I want a national type benefit plan, but I'm willing to work with an advisor to custom design it for me to meet my goals and objectives. And it's why you're seeing programs like Mark Cuban's program picking up steam because there are more and more employers that are demanding those sorts of solutions because they see the results. And these aren't new. These aren't new insurance programs. Many of these have been around for more than a decade, but they're becoming more available and they're gaining traction as employers are part of, CFO or a CEO may be part of a YPO group or a CFO roundtable. They're hearing what their peers are doing and they're saying, we need to figure this out in our business because we're hitting these limits where the Affordable Care Act has affordability thresholds. So you can only charge employees a certain amount and remain compliant. And there are many mid-sized businesses that are hitting those thresholds. And so now increases are having to be absorbed by companies. And it's now threatening their profitability, their bottom line. And they've got to come up with a solution to solve for it.
That makes sense. You mentioned Mark Cuban's venture. I know technology is changing how employers manage their benefits. Talk a little bit about that.
So pricing transparency. I'll start there. What's interesting is somebody may go get something as simple as an MRI, or maybe they've got to have their gallbladder removed or appendix removed. What most people don't realize is the pricing discrepancy and variation from one hospital or one facility to the next. You might go get this surgery and it's $60,000 at one facility, but right across the street it's 12. And interestingly enough, the quality of that $12,000 procedure may be higher than the more expensive one. So price and quality, there's no correlation in healthcare to those. And so the trick now is how do we design a health insurance program that incentivizes members to go to the best quality provider that also has the best price? And so that's where you're starting to see data and transparency information being pushed down into the member's hand through apps. And you're also seeing it at the systemic level, the enterprise level, where insurance plans are automatically designing certain providers, hospitals, and physician groups. You're going to pay less out of pocket, maybe even pay nothing out of pocket to see these providers that are the high quality, low cost. But if you want to go to the one that's not as good, you may pay more for that. So we're trying to find ways to design the insurance plan that's easy for people to understand and use, puts data real time in their hands so that they can make decisions that are best for themselves and their families. And ultimately, it's aligning the insurance plan with the employer, with the employee, so that everybody wins in the process. That's the secret here, is that you can design a win-win-win plan. It's just working with the right advisor that knows how to put those programs together.
Awesome. You have been doing this a long time and helped a lot of companies and made a difference. What's the biggest challenge you're facing now?
The biggest challenge that we're facing, that's a really good question. There's a lot of change happening in the marketplace right now. So I mentioned pricing, transparency data. It's not perfect. There's continued evolution with that, iteration of that data that's available. It's just finding the next generation, if you will. Like, what's the next iteration of the health plan need to look like? It's vetting out those vendors because there's continuous new entrants into the market. You don't want to be the first. You don't want to be somebody's guinea pig, right? So it's vetting out those vendors because the market's continuing to evolve. There's constant M&A activity, hospitals buying each other, gobbling up physician groups, insurance companies buying other assets out there. So the market's continuing to evolve. That's the biggest challenge, is just staying on top of what's going on in the marketplace because it's constantly evolving.
That makes a lot of sense. And you can change the name of the company to ABC Incorporated if you need to. Can you talk a little bit about an example of this is a client, this is what the challenge they were having when they came to us, this is what we did, and kind of this was that magical transformation you were kind of able to engineer for them?
Yeah, actually, I'll give you a really good example. It involves my brother. So my brother worked for a Fortune 500 company. He was down in the Houston area. And a client of mine that I was working with, they're not a Fortune 500 company. They're a large regional across Texas, a couple thousand employees. But their health insurance costs continued to rise every single year. And they wanted to figure out a way to provide better health care to their employees, but reduce the cost to both the company and the employees. And so this company set up what are called direct agreements with hospital facilities. So if you name any insurance company, they're trying to contract with every hospital and that's in a geography to say, we have the biggest and best network. When you have the biggest and best network, that means you have two things. You have all the good doctors and hospitals, but you have all the bad ones too, and the high cost ones. So we identified what's the right hospital facility for this group to get an agreement with. And what they do is you go to the hospital and say, if we send all of our patients to you, it's no cost to our patients. You're not going to have to collect a member deductible or out of pocket from them. You're not chasing dollars on the back end. Will you give us a better price than you would give to the insurance company? And the answer is yes in many cases. And so this particular employer, they brought in concierge physicians. They have direct agreements with these hospitals, and they tell the employees, you have unlimited access to these doctors and you have unlimited access to this hospital for whatever your healthcare needs are, because we know people are going to get sick and hurt no matter what insurance that you've got. And ultimately, what happened is their costs went down. Their costs actually run half the national average
Wow.
of the average American employer right now. But if you look at Kaiser Family Foundation, what the average employer is paying for an individual and a family, their cost is half. But I bring my brother into this because that Fortune 500 company was in the same industry as my client, and my brother worked a mile and a half from my client's office. But he had a health condition that had him in the hospital 26 times over a 4-year period and literally bankrupted him because he had his deductible every year, his out of pocket, out of network costs. And I looked at this situation and I thought to myself, here's a Fortune 500 company not really doing anything to address the cost of healthcare to provide more affordable care access to their employees. Yet here's a smaller company in the exact same market, a mile and a half from each other, headquarters. Yet, had he been employed with my client, he would have been able to use the exact hospital that he'd been using. His care would have been free to him, no cost, waived out of pockets. He would have been able to get the care that he needed. He wouldn't be bankrupted. And for the care, if you were to compare what his Fortune 500 company paid for his cost of care, his episodes over those 4 years versus what my client would have paid for those, very different in terms of total costs. So I look at this from the standpoint of it's not just about the bottom line to the company. Companies always say our employees are our biggest asset, which, yes, that's true. But it's not just about the bottom line to a company. It's about the bottom line to the individual members inside those companies. Because the reality is, and this is the way I think about my clients, they're employing people that are somebody's father, mother, brother, sister, cousin. These are people inside of these organizations that need help. The health insurance and healthcare market is really confusing. And oftentimes they need somebody to make it simpler for them and more affordable. And that's one of the ways that you can do this.
That's an absolutely incredible story. Your passion is obvious. What do you like best about what you're doing?
I love helping people. I feel like this is my mission field, if you will. And I think about the individual employees inside of companies all across America. They feel like they have no voice. And the reality is they don't have a voice individually against what they're facing in medical bills with hospitals, with insurance and those sorts of things. I'm their voice. And I get to take that to employers every single day to solve a real challenge that they're facing and to also help their employees solve a challenge that they face individually. And that's what I'm really passionate about. And I spend time traveling the country, teaching other advisors, speaking at conferences. And the thing that I'm most encouraged by is more and more advisors around the country are picking up this way of thinking and consulting with their clients.
Well, that makes a ton of sense. For our folks who are watching and listening and want to learn more, where should they go to learn more about you? And what states, for example, can you serve clients in?
So most of our clients are in Texas, but I do have clients from as far as New York to California to Florida and everywhere in between. So, you think about health insurance, it is oftentimes it's national. You got to design a plan that works anywhere somebody's going to go. So oftentimes clients that are out of state that want to work with us are looking for specific expertise, especially in light of COVID and the transition that a lot of people have had, considering that we're talking virtually. Most of our clients that are out of state are open to engaging in that manner because they're looking specifically for expertise. So we're open to working anywhere in the country. It's easy to find me. The best place to find me is a website. It's chrishamilton.com. ITSChrisHamilton.com. That's a repository that I've got links to questions to ask your advisor, making sure you're getting the best advice. I've got a playbook that walks through step by step what solving healthcare can look like for your company and for your employees, as well as a number of other resources employers can tap into. It's Chris Hamilton.
Awesome. This has been Seth Greene with itschrishamilton.com. Speaking to Chris Hamilton. Chris, thank you so much for joining us.
Thanks for having me. I appreciate it.
Thanks everybody for watching or listening. We'll talk to you or see you next time.
Why do so many businesses struggle while others seem to explode overnight? Do you wish you had the secret to this type of exponential growth? Now, I've scaled more than 20 businesses to over $100 million, and it's not just luck. In my new book with Mark Tim, Mentor to Millions, you'll learn the repeatable framework I use in all my business ventures for massive success. Order at kevinmentor.com and get over $1,000 in bonuses. Head to kevinmentor.com.